So a patient goes to you and they're wearing a denture.
Right.
What are their options when it comes to implants in your practice?
So they got several options with implants, and I want to highlight that this is customized to that individual patient, right? So options for denture wearers are anything from, if they have a traditional denture, let's say on the bottom, and that thing just skates around, that it's impossible to really hold that down because your tongue is kicking it up. Minimal, 2 implants right here in the front.
Okay.
If you put 2 implants here, you're going to be able to snap that denture in, and it's not going to skate around this way. Now, if we think of a chair, we think of a 2-legged chair. You can sit on a 2-legged chair, but you're good side to side, but you're going to kind of be rocking back and forth. You got to balance yourself, right? If you go to a 4-legged chair, that's rock solid. It's the same thing with implants under your dentures. If you have two implants here, you're going to have some movement this way. If you have
but
4
no more
implants,
adhesive with that option.
No more adhesive.
Okay.
Adhesive is out the window. That stuff tastes gross. It's expensive over the long run. It's horrible to feel like your mouth is all full of sticky stuff, right?
Okay.
So this is getting rid of adhesive. 4 implants supporting a snap-in, snap-out denture allows you to take your teeth and in the privacy of your bathroom, put them in and literally hear that thing click into place. That's a beautiful sound when somebody hears that, because that means strength, that means confidence, that means I'm going to eat, that means that my life is on the up and up. So 4 implants to support that denture is a next step up. 2 implants is one option. 4 implants and snapping it in and out is another. The next level to that would be putting, and I use 5 or 6 implants, and I put them all the way across where there's good bone in the right spot, and then we get to make a new set of teeth that actually fixes onto those implants.
They don't come out.
They don't come out, and that's as close to your natural teeth that woman or that man used to have when they were 20, 25. That's as close as we can get to giving them that back again. So there's each option there.
But the upper's good, right? I mean, there's suction on the upper.
So there's suction, but how do you get that suction? It covers the whole roof of your mouth. All these taste buds on the top of your mouth, your tongue wants to feel the skin on the top of your mouth.
Okay.
When you put a big plastic piece in there, it is awkward.
So they don't like that.
It's horrible. They don't like that. And some people have gone like that so long that they don't know the difference. They don't know what it's like.
So what happens when you convert them? What do they say?
I didn't think I could. I'm eating my wife's chicken pot pie, and I'm tasting things that I haven't tasted in 20 years.
Is that
I'm
right?
enjoying the things that are the small things that I never even knew I was missing out on now, right? So it's
like wine or cold things or hot spices or whatever.
Anything you're tasting.
Roof of the mouth. Okay.
Anything you're tasting. So let's talk about what you can eat, right? When you snap those those teeth in, you can start to eat broccoli. You can eat carrots now. You can open your mouth wide and bite into a burger. Or you can't do that with a denture, because you open your mouth wide, these muscles contract and they just kick that thing down, right? So even opening your mouth really wide to laugh, throwing their head back and laughing like this, I mean, it's a game changer.
So no more dentures, no more traditional
No more dentures. I forgot my shirt. I have a campaign shirt that says "No more dentures." I forgot it today. But
Is that right?
That's we're bound and determined to get rid of dentures.
Now you do this process all under one roof?
Right.
At your office, right?
Right.
You do the surgery, the imaging, everything right there.
Right. So with the technology I have in my office to take 3D X-rays and surgically, digitally plan the surgery before I even see you, and I'm visualizing, like when I'm talking to you, Randy, I'm visualizing what your final smile is going to be. I'm visualizing it, and then I'm using that as the template to then design down to the surgery. And that's where it's different than when you have several doctors that are doing the individual things, is that the design is happening from the final aesthetic, beautiful new smile outcome. And by the time we get to that final set of teeth that goes in, it's exactly what the patient wants.